A parliamentary hearing in Queensland heard horrific accounts from a courageous midwife who explained what happens when unwanted babies are born alive.
To give you a first example, a mother made a decision to abort her baby at 21 plus weeks gestation. The process began in the morning with misoprostol given throughout the day. The process took all day and the baby was only delivered during the early hours of a night shift, where skeleton staff was on duty.
Louise Atsett, who is a clinical midwife and has worked in maternity and birthing units for around 14 years, also told the hearing about how babies cling on to life for hours, receiving no medical assistance to save their lives or to alleviate their pain.
This baby moved vigorously, gasped for breath, and had a palpable heart rate. To make it clear, this baby was alive. It was over 400 grams, so the baby was a good weight. The parents of this baby did not desire to see or hold this baby. Midwives and doctors were left holding this little life while they continued to provide cares for other women who were birthing and welcoming their babies into the world. This baby boy fought for his life for 5 hours before taking his final breath. This is not an uncommon occurrence.
5 hours, 5 hours. The inquiry into babies born alive was looking into enshrining legislative protection for babies who survive abortion, either in the form of palliative care for those who will not live long or medical care for those who will. Joining me now is Professor of Law at the University of Adelaide, Dr. Joanna Howe. Dr. Howe, that testimony is harrowing. It certainly moved United Australia Senator Ralph Babet to introduce an urgency motion asking senators to vote on the importance of medical care for babies who survive abortion, but it was defeated.
It's unbelievable, Rita. 32 votes to 18, that was voted down, which tells you something about the quality of people that are in our Senate. Universally, unanimously, Labor and the Greens voted against that motion. And it was a simple motion. It was a motion that said if a baby is born alive after an abortion, they should be entitled to equal protection under the law. So it is absolutely, it's just disturbing. Like I actually can't understand how anybody, any Australian could vote against a motion calling for equal treatment for those children, especially after the harrowing, groundbreaking, courageous testimony of Louise Adsett the day before, who blew the lid on this whole thing.
Well, why aren't we seeing other midwives, nurses, doctors speaking out? If this is happening regularly, and surely more would be speaking out.
Rita, they can't. So Louise Adsett had parliamentary privilege. She was giving evidence to a parliamentary inquiry in Queensland, and so an employer can't take punitive action against you for something you say to a parliamentary inquiry. But any other midwife who speaks out about this will lose their job. That is just the reality of this. Immediately after Louise gave that extraordinarily brave testimony, Dr. Alicia Broome from the same hospital, who's an obstetrician, gave evidence to the inquiry saying babies are not born alive and left to die. So essentially disputing the very credibility of this incredibly brave midwife who came forward to say this. The reality is the peak bodies, RANSCOG, AMA, they're all lined up, and any midwife or nurse who's on the ground dealing with these babies who are gasping for air, who are struggling to breathe, who are left on metal plates for up to hours, these midwives and nurses are not protected. But I have now, since Louise gave that testimony, I've actually had 5 more midwives come to me and to speak to me about this. So I'm going to be airing these on my YouTube, but I'm going to have to disguise their voice and their face, because otherwise who knows what will happen to them. So, this is a tragedy occurring under our very noses in our hospitals every single week in this country. It has to be fixed. We do need more people to come forward. But the reality is the medical profession is not safe for people like Louise to talk about this in ordinary life, to people like you and me on camera. It just won't protect them, because this is legal. And you can only blow the whistle on stuff that's not illegal. And so, you can only blow the whistle on things that are illegal. And the reality is it is legal in our country, and it happens once every 7 days that a baby is born alive and left to die without a right to medical care.
The nurses you've spoken to, the midwives that have come forward since Louisa's testimony, are they also in Queensland? What have they told you?
So I've had one come forward from Victoria and the others are from Queensland. And they have told me about these little babies who are born. And one of them actually offered to adopt the baby, and she fought with the people above her to say, look, I want to take care of this baby can live. And she was shut down and the baby was left to die. And that is just a heartbreaking story. But I've had other midwives and nurses come forward to tell me stories of these babies who they want to hold them, but they're not counted as patients. So under Queensland law, the Miles government actually did change the midwife to patient ratios in a positive way a few weeks ago. But these babies who are born alive after an abortion, they're not counted as patients. So one midwife told me of a situation where she wanted to hold this baby that was born alive, and she wrapped the baby in a blanket, but then the call bell rang. So she had to put the baby down and just leave that baby gasping for air in the dirt, you know, and they go in the dirty pan room. So they go where the dirty dishes are, and that's where they're left gasping for air until they pass. So it's an absolute national disgrace. These senators who did not vote for this last week, it's just hard to comprehend. And it shows you that we need a massive wake-up call in this country. Mm-hmm.
And it wasn't just the Greens and Labor. We had Liberal senators. And what is the concern from these people? I mean, it seems to me insane not to be giving assistance to a baby that is gasping for breath, that somehow holds on to life for 5 hours despite not getting any medical assistance. Are they scared that if you acknowledge that this happens and have some sort of a process where they have to receive treatment, that it will put late-term abortion under threat? Is that why they're voting against this motion? It's hard to understand why anybody would be against giving assistance to a baby that is struggling for breath.
There were 4 Liberals, Senator Hume, Senator Birmingham, Senator Bragg and Senator Maria Kovacic, who voted against giving equal treatment to children born alive. Senator Maria Kovacic stood up in the parliament and gave 4 reasons as to why she was voting against equal treatment for these babies. She said that we haven't had enough time to discuss this. She said this is not urgent. She said these babies, the data, she questioned the data on this not being 1 baby a week. And she also said this is a decision between a woman and her doctor. Now, the reality is the Senate has had a born alive protection bill for 18 months on the books. So Kovacic needs to do a job and get up to speed. The data is very clear. It's 1 baby a week, and that's just in Queensland and Victoria. 1 baby a week who is born alive without a legal right to care. And this argument,
but Dr. Howe, it doesn't even.
Dr.
Howe,
it doesn't make sense, Rita.
I just think if you think the data is wrong, if you think it's been overstated, fine. You can still pass the legislation. The legislation isn't related to data. It's related to making sure a baby that's born alive after a failed abortion gets some medical care. So whether it's 1 a week, 1 a year, why would that prevent you from passing the legislation? I think we need far more scrutiny, particularly from those Liberal senators you mentioned. Dr. Joanna Howe, thank you for your time this evening.